Welcome to Valley Newsline for the week of March 18, 2007. Hello, I'm your host, Ron Whitlock. The Children's Health Insurance Program, known as CHIP, began as a federal stopgap measure to assist families whose incomes were too high to qualify for Medicaid, but too low to make health insurance for their children affordable. And many of these working poor families work for small businesses who cannot afford to provide health insurance for their employees. Now, the Children's Health Insurance Program, working with the state government, also co-funds it. 20% of those dollars come out of state coffers, 80% come out of your federal tax dollars you and I pay in Washington, D.C. The state of Texas made major changes to the CHIP program beginning in the fall of 2003. Started in 2000 under that administration, which was a bipartisan administration. Texas Governor, Republican George Bush, and Democrat Lieutenant Governor Bob Bullock, running the state of Texas, pushed through CHIP, got those federal dollars coming in the state of Texas. But when the state of Texas was taken over by 100% Republican top leadership in the state of Texas, major changes were made in the CHIP funding program beginning in the fall of 2003. And those changes were premiums increased, co-payment amounts were raised, dental care excluded, had to reapply every 6 months rather than once a year. The result, health care services received by children across the state of Texas declined significantly. One time, over 500,000 children were covered by CHIP, Children's Health Insurance, in the state of Texas. Now that number has shrunk down to 325,000, 175,000 of children in Texas no longer covered by CHIP, no longer have coverage for their health care needs as they once did. On the program, coming from the hometown of all three of our guests, Rosalie Tristan, Michael Tristan, and coming up in the next segment, Chris Caldera, who's with Valley Interfaith and also a teacher at Pittman Elementary School here in Raymondville, where this program is originating from. Rosalie Tristan, your son sitting next to you, welcome to the program. Now, you've been going up to Austin. You just returned from Austin, where you have visited with Texas Governor Rick Perry and other elected officials there, and as part not only of Valley Interfaith, but also as a parent of two children who had children's health insurance coverage for your kiddos. Now you no longer have that coverage for your children. Let's first of all talk about Michael, because Michael is a fresh face to have on our program. We understand he is well known across the state of Texas now. He recently appeared on television in Austin. Now let's talk to him first of all. Michael, you were interviewed by a TV station in the state capitol. That's pretty exciting, right?
Yes, sir.
Who interviewed you and what did they ask you?
Valley Interfaith, and they asked me if I had CHIP or not.
Uh-huh. And was this interview done in Spanish or in English?
It's bilingual.
A little bit of both? What has been the impact on you? You used to be able to go to the dentist, but now you can't go to the dentist?
They'd cancel his dental appointment because he didn't. They had said he didn't have the health care, and so the clinic tried calling the Accenture company that handles for the state, and they couldn't even get an answer through them. So they had to cancel his appointment because they never submitted me the card for me to take him, but I knew I had it. So when he went, he took time off of school to go to the dental appointment because I had one, and so they said they can just call us when you're there. So they called, and they couldn't even get through. They went 20 minutes, kept calling and calling, and they couldn't even get through the phone lines.
What has been the impact on Michael's health because of not having coverage through children's health insurance any longer?
Well, he hasn't had a physical, and so I really couldn't. I mean, I'd have to take him to a doctor, but if something happens, he's going to have to go to the emergency clinic because I have no health care.
So the old go to the ER problem rises as children's health insurance enrollment declines.
Exactly.
So what was going on across the entire state is many young people, many students whose family is working poor, had no health insurance, were going to emergency rooms, not only here in South Texas, but across the entire Lone Star State. That number was going down because of CHIP. Now that number is going back up again because of these 175,000 young people who no longer have coverage through CHIP, Children's Health Insurance Program.
Exactly.
So that's what's going on with you and Michael now.
Yes, sir.
You luckily have not had to take him to an emergency room for care.
That's true.
But you've been unable, what you're telling me, to be proactive to make sure he's getting care by virtue of the physical, going to the dental doctor's office, to the dental office, and get the work that he needs to do to be proactive about his health care needs.
That's correct. And I mean, here the state has this great program, but it's not being implemented correctly. And I've submitted my paperwork, submitted my application like I'm supposed to, made copies of everything I send, and then I call them because I don't hear anything from them. And you know, you're waiting to see if my family was approved or not. Didn't get no response, so I have to make the call, wait 30, 40, 50 minutes on the phone, contacting them again because I got disconnected, wait another 30, 40 minutes. And then at this time, I'm like, they didn't receive my paperwork. They're missing some paperwork. I said, how could you be missing paperwork when I submitted everything? I have copies here of what I submitted, and you only received half of it?
So part of the reason from what you're telling me here on this program is by virtue of the fact you're having difficulty with the third party who has been hired and contracted by the Department of Health
Exactly.
to get your enrollment and handle your relationship as it relates to CHIP or in this program.
Exactly.
And that is Accenture or that is Maximus. There are two entities.
There's two entities that contract for the state to provide the service for our tax-paying people in our community.
So obviously you're being very critical of the job that they're doing in order to handling your business and your relationship with CHIP.
Exactly, because then
So the reason your child, both of your children, Michael and his older brother, do not have children's health insurance coverage is because of Accenture not doing their job or because of the cutbacks made by the Texas legislature in Austin.
Exactly.
Both?
And both.
Both of those.
And my family is not the only one. Valley Interfaith works with a lot of families here in the Valley. And we hear the stories over and over. And we also have a network throughout the state of organizations like Valley Interfaith, and they're having the same problems. I mean, you hear stories coming out, worst case scenarios in my family. Some families that need direct, immediate health care and not getting it because Accenture tells them they don't have medical insurance, and then to come find out they did have it, but they were never contacted to tell them that they had it. So the child stays without going to the doctor.
How do you feel as a mother knowing that your child can't go to the doctor because you, even though working, even though you're employed, even though your husband is employed, you just cannot make it enough, you can't make enough money every month in order to handle all your bills and handle your responsibilities and yet have hospital coverage, hospitalization coverage, healthcare coverage for your child? How does that make you feel?
It makes me angry because, I've worked, I've paid my taxes to this community, to this state. I worked 22 years for a firm. I mean, I paid my debt to society, and and I still pay my taxes today. And I expect that money that I've invested into the state be invested back into our working families.
Both of our guests on the show at this point, Rosalie Tristan and Chris Caldera, both here in Raymondville, Texas. We will be utilizing in this segment of our program a report done called the CHIP Utilization in South Texas, done by Ann Millard and Nelda Meir of the South Texas Center School of Rural Public Health, Texas A&M University System Health Science Center. Research report just came out in December 2004, rather fresh information, done predominantly of families using CHIP in the city of Mission, Texas, in Hidalgo, one of the four valley counties of Hidalgo, Starr, Willacy, and Cameron County. Now, out of that report, this statement is made: if CHIP enrollment tends to decrease emergency room visits significantly, as you said in our previous segment, to put parents into contact with primary care providers before using the emergency room, a net financial effect on CHIP may be to save government funds, specifically This report says, out of Texas A&M, the state of Texas provides indigent care funds to the counties to pay for hospital care for the uninsured hospital patients who are unable to pay their bills. Once the indigent care funds have been exhausted, the county budget, then the hospitals themselves are saddled with the remaining expenditures. Therefore, CHIP may offer a sound way to save local dollars and ease hospital budget pressures. That conclusion made by a CHIP Utilization of South Texas analysis out of the Texas A&M Systems Science Center. Welcome to our little program here, Chris Caldetta. We appreciate you joining with us. An elementary teacher at Pittman Elementary here in Raymondville, what impact have you noticed out of your own students coming to your classes there in your elementary school as it relates to CHIP? How does this impact on their ability to study well and do well in school?
Well, I've noticed that when they are ill and they stay home for a while, and I check on them or I call, and then that's a problem that the parents have to keep them at home and weren't able to go see the doctor for one reason or another. So they are absent, and they start getting behind in their work. If they had this insurance and it would help them to take them right away, maybe we wouldn't have as many children absent.
175,000 children, predominantly students in public schools all across Texas, no longer being covered by the Children's Health Insurance Program, a federal program, 80% your federal tax dollars, 20% coming out of the state coffers. What does this tell you about our state government?
It's not providing or helping out with the promises that they had, that the families would be insured, that the children would not go without, and it's not providing what they had intended or said that they were going to help with.
It's been said that the children of Texas are the future of Texas.
Exactly.
This quote, "Sick children can't learn." That's from the Texas Federation of Teachers President John Cole. A child with a throbbing earache, a raw burning rash, or an aching tooth will have a hard time paying attention in your class and the class of other teachers all across the state.
That's right, because I've seen it. I've seen it with those earaches, exactly, and not feeling good, so they're not learning. And at the same time, I'm very concerned for them because they're not being cared for, or the family doesn't have the funds to help them with.
How many in your class?
I have 15 right now. I'm in second grade teacher.
And you're aware of children in your class who did have CHIPS coverage and now do not have CHIPS coverage?
Some I have, not totally, but yes, I have some.
Travis County Judge Sam Briscoe told a hearing at Valley Baptist Medical Center in Harlingen, it just doesn't make sense to give up $500 million that could help communities all over the state meet the health care needs of our own local children. We don't want our tax dollars going to New York or Illinois or any other state. We want that money right here in Texas. As we promised you, Texas Senator Kay Bailey Hutchison made this observation here on Valley Newsline several years ago.
It's very unfortunate that the state of Texas has actually left federal funds on the table for the CHIP program. Texas only was able to use $337 million, 1/5 of their federal allocation. They are leaving hundreds of millions of federal dollars to which they are entitled on the table, and by not acting, they're not then allowing these children to be covered. They're not putting the money into the healthcare system that we need to have in the Valley and the rest of Texas. It's really tragic that Texas had the money. They wouldn't call a special session to go ahead and put the program in place to get it going in time to get enough children signed up to use our federal allocation. And we know that Texas needs that money. So I've restored $600 million. I hope that Texas will get the children signed up so that they can use that money, which is legitimately theirs.
After making that observation that she had fought for those CHIP dollars to come back to the state of Texas, she requested and put the onus on Texas Governor Rick Perry to see if he could get that accomplished. Here's our question made to Texas Governor Rick Perry and a follow-up news conference a day or two later. Senator Kay Bailey Hutchison says that it's really tragic that Texas had $1.6 billion in health care funds, had the money, and wouldn't call a special session to get children signed up and get that program in place, CHIPS. She says she has had $600 million in health care funds restored, state funds that were lost by virtue of the fact they were not used, and the president had signed that bill with $600 million. Are you willing to call a special session or consider calling a special session?
First and foremost, I'm interested in where you got your information.
From her.
Oh, okay. Let us research it, because that's the first I've heard of the senator having $600 million available in her back pocket that she was going to make available to Texas. So that is all news to me.
So ladies, here we have the Texas senior senator, a moderate Republican, fighting for those dollars to come back to Texas out of the federal coffers where you and I had sent our federal tax checks. Texas Governor Rick Perry, right there, involved with cutting back the enrollment procedure and time frame from 12 months to 6 months. Your reaction on those two political leaders and what was going on when they made those remarks?
As far as cutting back from the 12 months to the 6 months, I think it's
Which has ended up with the decrease in enrollment from
Exactly.
500,000 to 325,000.
well that we've met with Kay Bailey Hutchins also. Valley Interfaith has met with her in Washington. I myself went and made a trip 3 years ago, and to make sure that our continuous funding from the state would come down. But then you've got the state officials here that are having to send back $863 million back to the federal government for money that was not used in the CHIP. And as you can see, my family is in need of this health care.
According to Dr. Anthony Kimbrough of the Texas Medical Association and the Texas Pediatric Society, we in Texas have the highest rate of uninsured children in the United States. With the decrease in CHIP, it's even worse. 175,000 children formerly covered by CHIP, Children's Health Insurance Program, one time 500,000, now 325,000. 175,000 students in the state no longer have this coverage, and up to $500 million going back to Washington, D.C., then being sent over to some other state who is using their Children's Health Insurance Program.
Well, we've met with the governor, this legislation. We had a group of folks from the Valley go. We met with him about 2 or 3 weeks ago. And we told him that we wanted Texas children not to be forgotten in this legislation, that our kids are important to our families, that money that's our taxpayers' monies in the state needs to be spent on our Texas families, not on tax cuts for businesses or corporations, but that we want that funding coming back to our children.
And where did this meeting
In his office.
place?
In his office. We were 20 leaders from throughout the state, from our network, from the Organizations of Industrial Areas Foundation. We gave him what we wanted. We wanted 700,000 children back on health care.
And at the end of the meeting, what did Governor Perry tell you?
He says that the legislatures had to make that decision of what was going to be done. And so Chris met with some of the legislators there while we were...
We met with Eddie Lucio and Senator Eddie Lucio, and we met with Rene Oliveira through the telephone interview because he was ill, and they were working on that too. And we told him that we didn't want this to be anti-children. We want the children not to be left behind, but to be able to have that insurance coverage so that they will be able to succeed in school. And both of them were assured that that was going to be done. It's not going to go back to be restored like in 2003, but hopefully we're going to be able to get all that money that we're asking them to get.
And I'm glad you're doing this interview, because it's very important that the other legislators that are not supporting this bill see that, because you don't want those legislators to be anti-children. And that's what's going to happen if they do leave out our children. That's what they're going to be remembered as, the anti-children legislators.
If CHIP enrollment affects emergency room visits on the part of children, if they don't have health insurance through CHIP, they go to ERs across the entire state. And those bills either are not paid at all, impacting the county indigent care fund, or the locality, or the hospital who can't pay it, or the employer who may get the bill. Vanity Fair in the city of Mission is contemplating closing down that plant, losing hundreds of jobs here in the Rio Grande Valley, your neighbors, because one ship was cut. Their children or their employees started going to emergency rooms in Hidalgo County. The bill then began going to Vanity Fair, and their costs were going up so high that now they may be forced to close their plant and go offshore with everybody else. That's the last cut and sew plant here in South Texas. So there is an impact between CHIP being in effect or not in effect, being able to be enrolled on an amicable basis or not on an amicable basis.
It's a ripple effect, and it goes down to the schools too. And then you have the families that'll go bankrupt because they can't afford to pay the hospital bill or either go bankrupt.
There used to be a hospital in Raymondville, Texas.
Yeah, it's been about, what, 20 years
Oh,
ago?
quite a while, yes. We used to have one.
One of the reasons that hospital no longer exists in Wilson County is because it couldn't get paid.
Exactly.
So it's this kind of thing that determines whether you have a hospital locally or you don't have a hospital locally.
Exactly.
175,000 Texas students no longer covered under the Children's Health Insurance Program. 80% of those dollars come out of the federal coffers of tax money you've sent to Washington, D.C., 20% out of the state coffers in Austin, Texas. Our two guests on the program, Rosalie Tristan and Chris Caldera, both of Valley Interfaith, one in education, one a mother of three, two formerly covered under CHIP. Look in the camera and talk as if you're talking to Texas Governor Rick Perry, who has other plans in mind of offices he wants to fill, because he probably is not going to be running for re-election. That's what he tells everybody at this point in time. Look in the camera and tell him why he needs to support CHIP and needs to twist the arms of those other Republican lawmakers that he has a little bit of influence on, of why they need to help CHIP get restored to the levels you think they ought to be.
Okay, Governor Perry, this is very important. You don't want to be the last governor going, now this state of Texas being anti-children. We want you to put pressure. We've been with you at your office, and we want you to put pressure on your legislators because our children are very important. The No Child Left Behind is important, so are our children. We don't want our children left behind when it comes to health care.
You can help us by talking to some of those legislators and saying that it is very important and you are with them and that you're going to do something about it. Don't just lay back, because we don't want to remember that you did just that in the future for any other things that you might want to deal with.
And with that note, we'll say you can go to valleynewsline.tv if you want to watch the earlier segments of this program in case you missed them. Till next time, adios.